Welcome back to Spotlight, and I'm right here with our emergency team, paramedics, Supervisor Mr. Rodney Brathwaite. Good to have you, my brother.
Thank you.
Thanks for coming to Spotlight. And Ms. Tashima Barzi.
Hello.
Thank you for being my guest on Spotlight. Now, I was learning off air that there's a difference between an emergency technician and a paramedic.
Mm-hmm.
And I wasn't quite clear about that, and that's just the first thing I wanted to clear up in my mind, because I like to ask what I don't know.
Okay, an emergency medical technician, they do the basic things. Mm-hmm. They can check your blood pressure, they can check your blood sugar, they can give you oxygen. A paramedic, on the other hand, after I check your blood pressure and I realize it's low, I can give you medication to raise it. I can give you fluids to make you better. So that's the difference. And we also, with paramedics, we also can put tubes down your throat to help you breathe, intubation, and check your cardiac rhythms. So EMTs don't do that.
Okay, so you're closer to a doctor than a technician.
Yeah.
Yes.
Yeah. I mean, you don't know how close you are, but so this is Emergency Services Week.
Mm-hmm.
Why the need for Emergency Services Week? You try and draw attention to yourself?
No, we are part of a worldwide profession, so basically what we're doing is celebrating that profession worldwide. Mm-hmm. And in the meantime, allowing the public to know what we do as part of the whole healthcare continuum. Basically, that's what we share during this week. Because a lot of people just see us as ambulance drivers and don't understand exactly the whole role that the ambulance service or the EMS plays in the whole healthcare field.
And what's your theme this year?
EMS Strong.
EMS Strong.
Yeah.
And why that it's strong? How? What
Strong
that means?
because we want to let the public know that we are part of a whole healthcare continuum and the strength that we have and the role we play. So that's basically what we're looking at this thing.
And you had activities that you celebrated this week?
This week we started with the church service at the Roadtown Methodist. During the week we are doing a lot of school work, public education work to get the kids into choosing this career going forward. And tomorrow we have an exhibition at the hospital, so we're trying to invite the public to see exactly the equipment we carry, how we use it, what we do, and ask questions that they better understand our role.
Okay. Now you're right, and I think your statement that we usually refer to you as an ambulance driver, and which is perhaps something a little insulting. I think. I mean, from my personal perspective, I don't know how you.
We take it that way too.
You take it that way,
Yeah.
ambulance driver. But what do you do as a paramedic, as an emergency services person?
In terms of the patient care wise?
Well, yeah. What do you do? You obviously pick patients.
We go to the patients, we do a full assessment, we take a history, we, depending on what we find, we manage and treat, consult with the doctor at the hospital, and then transport that person there. So basically our job is providing treatment and care for the sick and injured, and transporting those patients to the hospital for further care. And trying to give something to preserve life, because without us, sometimes we wouldn't get there.
So you get the hospital gets called, and there's an emergency or someone needs assistance from a location that they don't have access to transportation, for example, and you're called to go and get that person or go to that scene of the accident, perhaps, and you have to be equipped to maintain life. Tell me about that.
In terms of when we get there, we do a full assessment. Suppose we use the accident as a main example, because what we found here is that public normally comes across accidents and they pick on a run with everyone and trying to get them to the hospital quickly. But that in itself is a danger to the patient. But we are trained to come assess you and stabilize you and get you there and to keep everything intact for you.
So if I come upon an accident and someone is lying on the ground and I can pick them up, I shouldn't move them?
You shouldn't move them.
Shouldn't touch them at all?
Because you can cause them to be paralyzed for life.
Okay. And what about the chances that if you take too long to come and I take them directly to the hospital, I might save their life? That makes sense?
That might be true, but the risks might outweigh the dangers. I mean, the benefits of it. So we would rather you call us, because you have the lay person might not be able to do the assessment and don't have the equipment to stabilize that person, which we come with a C-collar, a backboard, that type of stuff.
Now, what kind of challenges you have as a paramedic? I mean, how, you go out, you get people that do you get abused, people get angry, people, I mean, what sort of challenges you encounter during your daily routine as a paramedic, if you can call it a routine?
All right, one of the first challenges is actually how people access the system. Come through the 911 system, we're supposed to ask you a number of questions. Some people, because they don't understand our role, which is one of the reasons why we're here, when we try to get information, they see it as a waste of time. They try to tell you, well, you don't hurry up and come. Not realizing that if we don't know where to come, we can't ever get there. We need a callback number. Not because we want to be able to have another conversation, but in case we get lost, we can call you back or call you back and give you some information on what to do with the patient until we get there. So those are some of the challenges. The other challenges we find on the road, we have carriers not giving way to the siren, people trailing the ambulance, which can obviously cause accidents for us. Then the way how people build their houses, sometimes it's hard to get persons in these high-level houses that we have here in BVI down the stairs. And that in itself is posing a big challenge for us. That stuff is posing, really making the job very challenging. Where people live, the actual roads going towards the houses, very challenging sometimes.
Well, I mean, those are challenges that you're going to have to mitigate. You have to mitigate in some way because people now, I mean, in the United States, for example, many houses have upstairs. How do they manage? I mean, is there special equipment that allows you to mitigate those circumstances?
They may have a building code. Some houses, and I'm not sure if there's a building code here.
Well, you're certainly not saying that we shouldn't build a house with that upstairs and downstairs.
But if you build it, have somewhere that we can access it. Because some of the stairs are very narrow.
Okay,
you can't get up.
So your problem is stair width, incline, and those kinds of challenges.
Because we can always call for help. We can call additional resources to help us bring it down the stairs. But sometimes the challenge is when we call additional resources, 2 persons might not be able to fit on the stairs or 3 properly. But equipment-wise, I think our equipment is standard. We on par with the rest of the world in most of our equipment here.
You could chime in anything. Take me through a process. I'm at home and I have an emergency. I don't know what kind of emergency I should pick up here now.
A chest pain. Make it easy.
A chest pain. Yeah. What should I do in terms of getting an ambulance to me? I might be in a remote location. Well, I am in a remote location. What do I do in terms of getting an ambulance to me? How prepared should I be to get the medical attention I need in a remote location from the emergency ambulance service?
First off, you need to call 911 or 999. And when we ask you the list of questions, what's your name, where are you, and your callback number, and what's going on. We need those information because it might be just 2 EMTs working, and if they think they need an additional person to come, maybe the supervisor or the paramedic to come with them, those kinds of things they would like to know in advance instead of waiting for the person to come for them. So when we get all that information, we leave the hospital, we navigate through traffic, the wonderful traffic we have, and we get to you.
But before you get to me, I have to give you a certain amount of information, right? What I need to know about myself and my location to make it easier and more efficient for you to get to me. Because the conversation is going to go something like, where are you? Well, I'm over here by the hot pen, and when you come down Bellevue, you got to look for the hot pen and then make a right, and
landmarks are important.
So, should persons in remote locations have a certain set of directions, perhaps even rehearsed, so that it's clear and effective for you to reach to them? Is that a preparation that a person, whether they're sick or not, in a remote location should have?
Well, that would be good.
It would be good.
It would help a lot because some persons, in the heat of an emergency, forget exactly where they live. So sometimes they tell you turn left and it's really a right turn. And it'd be nice to have those directions and everything in preparation for arrival, as well as your medical history, your identification cards, your hospital cards, medications, that type of stuff. So that when we get there, we can ask, get it, and move rather than you having now to look for it for us.
So all those things should.
And
should
if you have dogs, you try to put them away because obviously dogs can run us.
yeah.
There's one thing about the landmarks I want to say. It's better to say turn to the blue house on the left as opposed to turn to Tanty May's house who sells a special. She had that daughter from this. Because a lot of our staff right now are not originally from the Vivier and did not grow up here. So we're not familiar with Tanty May who sells a special, who daughter went this place and that place. So
Landmarks
as in
very,
houses
very,
or very much like signs and things like that.
very, 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 very important. Okay. Now, sometimes you come to a emergency situation, and you come to a family, and persons want to go in the ambulance with you, you know, and they don't want to leave their loved ones, and they may or may not trust you as a paramedic, and so they want to make sure they're there to watch everything that happens. Is that a challenge? Does that pose a challenge for you?
I wouldn't say that because normally we take one at least family member with us because sometimes.
So you're allowed to take one family member, only one.
I would say yeah, because we don't want to overcrowd the vehicle. We still have to work to do so. If one sits in the front, we have 2 paramedics and our 2 EMTs in the back. The ambulance space is not enough to hold 3 or 4 people, and sometimes the family might actually get into our way when we start to do some work. So one is acceptable and reasonable for us.
Okay. And are you making taking steps to get people to be more informed, or what sort of plans are being put in place for the emergency services to be more effective and more efficient?
We plan a lot to do some public awareness, education going in the future. We have to do that in order to get the public to be aware, first of our role and what we need from them. So that's one of our biggest things going forward, because if the public don't understand what we do and they can't access us, then we're basically wasting our time. So one of our biggest plans, and we're starting it with this EMS week, is public education to get the public more involved in what we do.
Okay. So do you have a list of things? I mean, I may have touched on a few or touched on 1 or 2 things, but do you have a list of things that you're going around and saying to the public, these are the things that you need to know. This is how you need to behave in an emergency situation. This is what we need from you in order for us to be more effective. Do you have some sort of a program?
When we went to the school today, we went to Leonardo Derville. We informed the children that when you see someone hurt, you call 911, and we impressed upon them the importance of giving your name, your address, landmarks, and staying absolutely calm, because if you're not calm, we will not be able to communicate. So that's one thing we are definitely doing with the children, because I know they will go home and excitedly tell their parents, the ambulance came today and this is what they said. So we're starting with the schools and then branch out from there.
Okay. Is there anything that the public needs to know from a medical perspective in dealing with an accident that they may come upon, besides not touching the patient or making sure that they call you first and perhaps wait till you get there, or whatever the case may be? Is there anything that, at all, that the first person that arrives on the scene can observe, and through that observation make a decision that's helpful?
Yeah, when they arrive on the scene of the accident, as you said, first thing they do is they can take a brief outlook at the whole scene, and when they're called for the ambulance 911, we are so trained to ask you enough questions to get the information we want. So we can ask things like, is there bleeding, anyone trapped, the vehicle on fire, all that information we will need. And that is very important for us because that helps determine our response.
And so a person coming upon an accident or emergency situation should observe the situation, see what's happening, and what the dangers are, perhaps, so that they can give you that information on the phone.
If suppose the person struck an electricity pole and you have down wires, that's going to be important for us. Rather than we just rushing in, although we will do our own assessment, it's helpful because from early we can inform the necessary persons, utility companies, exactly what has occurred, and they can make the necessary steps to have the area safe for us when we get in.
Okay. So what else can we expect from the paramedics?
The whole EMS system.
The whole EMS system. What?
All right, going forward in the future, we'll like to take the whole pre-hospital care to the sister islands. We know that that is kind of lacking at this time, and in the future, within the next 5 years or less, we would like to have our presence in Josephine Dyke and Igada. We already have a presence in Virgin Gorda, but we're strengthening that. So into the future, that's one of our main things we are working on in terms of our strategic direction, and providing more training for our staff. Because what we're looking at, once we arrive, the first point of contact, we want to be able to provide the right care at the right time. So that's one of our things going forward.
Okay. So right now, I just heard you have the ambulance boat in Virgin Gorda. Is that coming on stream?
Hopefully that'll be on stream very shortly.
Very shortly.
Very shortly.
And so you're going to have persons assigned to that.
Hopefully.
And what yeah, like just like how you have a ambulance driver who is a paramedic.
As you can have a boat captain who's one.
Yes, yes, yes.
Well, that's the decision for the hierarchy.
But is that something that should be a part of that system?
Well, he might not be a paramedic, but we provide training.
Or not necessary. That's not necessary.
We might provide training that he can still assist in the case there's an emergency out there. Because when he's steering the boat, there's no paramedic work to be done.
Right, right. That's true. And you want to get to the sister islands, and you want to get a whole system.
Whole system in place.
How important is that for the hospital accreditation process? How important is the emergency services to the standards, the hospital standards, improving the hospital standards and the quality of care?
Well, going forward to get accreditation, we must have the services meeting a particular standards. So we must set those standards. And it's going to be, as I said, it's going to be very critical to us getting that accreditation stamp, because we're looking at medical tourism and that type of stuff. And if you're looking at that, all of our services must meet a particular standards. So having our services benchmarked against international standards is going to be very vital and very critical for us going forward.
Okay, great. We finally turning the clock. We have fallen under the tyranny of the clock. You know, the clock as a terrorist. You know. And I just wanted to know if anything we missed out, any other information we want to bring to the public. You know, while you're here, take this opportunity to share. Tell them all the things I forgot to ask you.
Go ahead, Bertie.
Don't be afraid to call 911. I know some people are not sure if certain things should be called in, but just call. Don't ever not call. And if you're feeling ill, please call. Seek medical help. That's the most important thing.
Okay.
The other thing we would like to tell the public, we are looking at a lot of courses for the public, first aid courses, public access to FIBS, because my thing is I can have the best trained ambulance service in the world. If I can't get to the public in time, it's going to be a problem. So I know it will always be a challenge based on our terrain. So if I train the public into certain life-saving skills, they can do a lot until we get there. And that's one of the things we'll be pushing a lot from our EMS standpoint, public training first aid, how to get defibrillators in certain EDs in certain parts of the country where crowd gathers a lot to save lives. So the public can stay tuned. EMS is coming to get you soon.
And I think that's important, because I think that's what I was asking about. You know, how prepared should we be as individuals, non-medical personnel, non-medical individuals? How prepared should we be to take care of ourselves until the emergency services arrive? And it seems to me that it's important that we learn those skills.
Basic first aid.
And you're planning to bring those skills to the public over a period of time.
Yeah, very soon.
So we can expect that you'll be on the radio and on television.
On the radio, doing public work, meeting community groups, providing training. That's what we'll be doing out there.
Mr. Bradford, Mr. Bazzi, we appreciate
Miss Bazzi.
Miss Bazzi, sorry. Yes, we appreciate your service, and certainly I think it's important for the public to be aware that you are important to the healthcare, and certainly emergency service is a lifesaver. And we want you, I personally want you to know that we appreciate you and all the work that you do.
Thank you.
Thank you.
Yes, thanks for being our guest on Spotlight. And have a good remaining emergency services week.
Thank you.
Thank you.
Yes. We're gonna
Hopefully
take,
we'll be back again.
well, anytime. Anytime. I have no bureaucracy. We're going to take a break for a word from our sponsors. We're going to come back. We're going to come back with Mr. Paul Hubbard. He's a volunteer advisor. And Mr. Javier Lopez. He's the public relations officer at Lyric Bay for the poker run. And we're going to talk about the poker run and the excitement coming up very shortly. Keep it locked right here at Spotlight. We'll be right back after these words from our sponsors.
Spotlight is brought to you by Tortola Concrete Limited, the National Bank of the Virgin Islands, and CCT Global Communications.